lovely disclaimer. When you go to the website, you get this lovely disclaimer for all things legal that we have to put there. But right there, if you're trying to get hospital access, you can register. You can find out how to use the dashboard. You can learn more about the data, but I'm going to just continue to the dashboard website. So I showed you this a little bit. Again, the registration form is here. It allows navigation down that kind of shows you these really digestible examples and all of the measured definitions. But at the top here, I'm going to go to available reports, and there are two reports here. So if you are a hospital user, you're going to log in here with your login. And when you get in, I can't show hospital level data in a public recording, but you'll have drop downs for each of the hospitals that you have access to, and you will have unrestricted ability to play with the data. So here's the launching the public dashboard. And so here on the dashboard, we have a few things. If you are trying to look at just some general descriptive data, what does the maternal delivery population look like, or what does the newborn baby birth situation look like within the state or within a region? This is the dashboard to go to maternal health or newborn health. I'll play around just with maternal health, but you can see here for all 3 years of data, there were 147,000 deliveries on the dashboard. It's rolling, so we only ever give you 3 years of data. When we add a quarter, we take a quarter off, and you can see that underneath here. So, but let's say I am doing a report where I want to show just what happened, because I'm giving a report to the Medicaid agency, and they deal with state fiscal year, and so I just want to show them within one state fiscal year, what the maternal delivery population looked like. I can, here is just state fiscal year 24. You see that number of deliveries dropped down, and here's a breakdown by age. You can see here some drop. This is actually, we're seeing this nationally, some drop. Sometimes as you get to closer quarters, we also just have a data lag that leads to that. And there's lots of disclaimers about that. This just tells us the capture of deliveries by race. And then I might want to do something else, right? So I might want to, the report was to Medicaid, right? And so now I want to just look at Medicaid, okay? And so now here, I'm able to break out that data just for the Medicaid agency instead of overall, and I can do all kinds of things with that. You can print, you can download the data, and so here you have time and you have payer, but if you were to try to do time, payer, and age, it's going to block you because this is a public dashboard and we're getting too small. You could clear those filters though, and maybe now I'm doing some community health worker initiatives with Diabetes Free and Duke Endowment. And I just need some data about mothers who are delivering who have diabetes, right? And so I'm going to go there. And we break it down not just by diabetes and no diabetes, but you can look at those that were pregnancy induced, those type 1 and type 2 cases that existed before pregnancy, or you could look at all, right? And so the data just switches for you. And you can see here kind of the community population that overall, and within the dashboard, we're dealing with about 2,200 patients who had diabetes within the state. You could look at this at your hospital, though, and really drill down into those diabetes cases. A lot of hospitals are looking at avoidable cesareans. And so the labor and delivery tab, it used to be the inductions and cesareans. Like I said, that induction data, early elective delivery data is really wonky, and I see 10 time periods. And so we've removed it. A lot of national folks have removed it. And right now, the labor and delivery measures that you can get are your total cesareans, your total first cesareans, that primary cesarean measure that we're all reporting for the Joint Commission, which is the one I kind of described before, and an AIM measure, which is primary cesareans among those with cardiac conditions. So I want to look at just that PCO2 measure that we're tracking often. And you can see a lot of variability for our small hospitals. So what the chart shows you on the right our level of hospital, level 1, level 2, level 3 in the state, with the state being a cute little state piece there. And you can actually switch it and download data as a table. or you can look again at the line chart. And maybe I want to see primary cesareans by those who had inadequate prenatal care, right? And so now I've filtered it by avoidable cesareans and prenatal care because I was trying to write a report to show the need for enhanced access to doulas in the prenatal period, right? So it allows you to kind of filter the data and to look at trends. Why do I see such variability at a level 1 facility? We're talking small number of deliveries, and if functioning as it should, we want to transfer those moms, right? Those high complex moms to your level 3 and 4 facilities. And so you'll see a lot more variability when you're dealing with a smaller level hospital. So that context is important. And then down here, you can actually look at the rates across. We actually see higher rates of primary cesareans that are potentially avoidable in our level 2 facilities. Our level 2 facilities often have disproportionate number of mothers who self-identify as white and who have private pay, and those are two populations that have higher rates of elective cesareans. And so again, that data without context, better understanding the why behind it is really important. If I look here at the level 3s, that's really helpful because the level 3 facilities are seeing our highest acuity patients and our high severe maternal morbidity cases, right? So this is really a wonderful finding. We would expect that our level 3 and 4 facilities would have higher rates of primary cesareans that are potentially avoidable, and they are at the same level as the level 1 facilities. Same thing as maternal health snapshot, but this is the newborn health snapshot. In this case, we're looking at low birth weight, the number of births, and prematurity, and you can filter the data in many of the same ways that we talked about before. On the newborn outcomes, many of you are participating in the agency's quality collaborative, and that is tracking low birth weight and prematurity as hospital metrics and state metrics. So you can pull all of that out. We separate moderately low birth weight from very low birth weight, right? Because of the very low birth weight, a lot of things are going on with that scenario. You can just combine those numbers to get your low birth weight overall rate, or just subtract from 100 the not low birth weight to have that. And one of the reasons we do the moderately low birth weight is retrospective from when we were looking at early elective inductions at 37, 38 weeks and trying to reduce those. Early elective inductions at 37, 38 weeks will reduce moderately low birth weight, but not those very low birth weight births. And you can look at all the levels of prematurity to actually term plus. And then where a majority of our focus in the state has been through BOI and through MHI and even Title V has had historical focus, has been on reducing those highest acuity cases at the time of delivery, that severe maternal morbidity, as part of the AIM initiative that many of you are a part of. And so a lot of that really nuanced reporting, we are reporting it on behalf of hospitals to AIM National and to DHHS. And some of this data is actually going into some new initiatives around quality that the Hospital Association is driving. But this is one of my favorite dashboards because there's just so much that you can look at here. On this dashboard, you can look at both the drivers of severe maternal morbidity and some of those major factors driving SMM, and you can look at SMM overall and within those factors. So this dashboard here allows you to look at overall maternal hemorrhage at delivery, cases of severe hypertension, that preeclamptic and eclamptic, cardiac conditions, and here we take out the hypertension and we're looking at things like AMI and other very severe cardiomyopathy cases. We can look at mental health conditions. Mental health is the only AIM measure on the dashboard that is holistic, looking at the entire perinatal health period, because perinatal mental health often happens not at the time of delivery, but later postpartum. Within each of those, we can look at the rate of mothers who had a severe crisis at delivery, right? And so this allows you to prioritize at your hospital what kind of SMM really needs to be the focus and among who. So right now, we are focused on the severe hypertension bundle. And I can filter this as you see here, great variance in which type of hospital is seeing cases of severe hypertension, as intended to somewhat because of transfer. And then within hospital type, I can look at each of these factors, and I can look at cofactors, right? So I'm looking at severe hypertension, and I want to now look at those who had type 1 or type 2 diabetes, right? And you can see here some spikes in those rates among the subpopulation, right? As we really try to really figure out which mothers need our greatest support. I could look at it by race. And these numbers, you could, if you're wondering, why am I only able to do one filter? If you think about SMM in the state as a whole, you might only have 500 cases a year, right? So you would just get a bunch of empty dashboards if you were allowed to filter at many, many levels. So this is really powerful data. We hope to add to this the last remaining measures, which are around substance use disorder, within the next couple quarters. And I already talked to you about resources, and I already talked to you about the improvement tips. But if you were to click on the improvement tips, you're going to get a whole bunch of information on how to actually address the conditions that you're seeing within the dashboard. So I'll stop sharing there. That was very quick. I'm 1 minute over.